Good evening, ladies and gentlemen. The chairman of the Presidential Task Force on COVID-19, honorable ministers, members of the Presidential Task Force, dear Nigerians watching us from home and from your offices, gentlemen of the press, a very good evening to you, and welcome to the national briefing for Monday, 24th of August, 2020. We'll take the remarks of the chairman, after which the Minister of State for Health will give us the update, followed by the NCDC and the National Coordinator, before we cross over to the question and answer sessions. In between, if we have other updates from the honorable ministers, we shall gladly invite them to the podium for such updates. So at this point, let me invite the chairman of the Presidential Task Force to the podium to make his remarks. Mr. Chairman, sir.
Members of the Presidential Task Force, distinguished ladies and gentlemen of the press, I welcome you all to the national briefing by the Presidential Task Force on COVID-19 for Monday, 24th August 2020. Last week, Thursday, we informed you that Nigeria had crossed the 50,000 mark of confirmed cases. Yesterday, Sunday, 23rd August, we reached the unenviable record of 1,000 fatalities. We wish to restate that these records are not just numbers, as they vividly remind us of the dangers that we face as a nation. May the souls of all those that have lost the battle against COVID-19 rest in peace. The Presidential Task Force has, however, continued to study the case fatality rate, CFR, and we note that it has been on a steady decline over the last few months. For example, April 30th, the case fatality rate was 3%. On the 31st of May, it came down to 2.8%. 30th of June to 2.3%, and 31st of July to 2.0%. And finally, August 22nd, the case fatality rate was 1.92%. We are, however, convinced that our sample collection is still low because our capacity for testing now is about 15,000 samples a day. But our record indicates that we're collecting and testing something between 2,500 to 3,000. We therefore encourage states to ramp up their testing and to appropriately file in the results and declare the results as quickly as possible, because early detection will ultimately translate to treatment and ultimately enable us level the curve. With our statistics standing at cases 52,227, fatalities 1,002, and recoveries of 38,945. Nigeria, however, still maintains the fourth highest cumulative cases on the continent. Sadly, the global cases have increased by 1 million from 22.5 million on the 19th to the current 23.5 million in just 4 days. So within a period of 4 days, we've had an increase of over 1 million cases, in spite of all the resources that is being thrown at COVID-19, trillions of dollars all over the world. The spread of infection has not abated. The Presidential Task Force has already informed you about the plans to reopen the international airspace for flights in a manner that will promote safety, security, and economic recovery for our nation. The National Coordinator would update you on the protocols during this briefing. We have been working with other sectors to develop appropriate protocols that would ensure that we do not open at the expense of getting new infections being imported into the country. However, prior to the reopening of the airspace, the Presidential Task Force has put in place point-of-entry protocols to minimize importation of the virus again. Unfortunately, the validation process for the pre-boarding PCR tests have shown, for instance, in Lagos, that out of the confirmed cases in Lagos on Saturday, 28th, that stood at 404 of those cases. 64% of that infection came from all manners of evacuees and the people who were returning from other countries for the purposes of going back to their places of work. That is a major source of concern that the Presidential Task Force will be looking at critically in the coming days and months, so that we ensure the validity of the pre-boarding test certificates that are presented to the airlines before we receive people coming. Over the weekend, 252 additional Nigerians were evacuated from the United Arab Emirates, which has brought the total number of Nigerians that have returned home to 4,984. We shall intensify the validation process for the PCR tests to minimize risk. It is very important that we remain vigilant as we open up our airspaces and ensure that if a PCR test is presented, the validity must have a certain degree of authenticity, like I said, to stem the tide of re-importation of the virus. The WHO has provided guidance on the use of masks for children 11 years and above in the context of COVID-19 as it relates to the community. However, children with immune-compromised conditions are advised to wear masks irrespective of their age. Whether below 11, if a child has an immune-compromised position, it is advisable, particularly when such child steps out into the public space, to ensure that they wear their mask. This guidance is strongly recommended for observance, and the Presidential Task Force shall update you as soon as it is revised by the World Health Organization. This morning, we received the unfortunate news of the positive status of Professor Akin Abayomi, the Lagos State Commissioner for Health. This truly has been quite saddening to the Presidential Task Force, as the Commissioner has been foremost in the fight against COVID-19. At this juncture, we wish him and all other frontline workers that have risked their lives, but in the process of standing in the defense line on behalf of the people of Nigeria, have contracted the virus in the process. We wish him safety and speedy recovery. Our prayers are with him and other similar frontline workers that have put their lives on the line of fire in this battle against COVID-19. This unexpected news is a grim reminder that the virus is no respecter of persons or the positions they hold. Everyone is at risk, and we must take responsibility and ensure that we protect ourselves and also protect others. What the announcement of Professor Abayomi has shown is that stigmatization has no place in our national response. He is the Deputy Incident Commander in Lagos, and he has fought diligently day and night in this battle against COVID-19. And that COVID-19 is not a death sentence. We therefore thank all those that have come out to announce their status and or tell their stories. I stumbled over the story or the testimony of Segun Awolowo yesterday on the social media. Quite revealing and quite encouraging. And I want to urge Nigerians to take a cue so that as we share these stories, we would help eliminate disbelief and skepticism with regards to whether COVID-19 is real and is here with us or it's a hoax. Let's keep arming the unbreakable Nigerian spirit to win this war and drive the virus or tame it out of our land. Join the hashtag #MaskOnNiger National Awareness Campaign. And I have the honor to call on the Honorable Minister of State Health and the representative of the DG, Nigerian Center for Disease Control, and the National Coordinator to provide us with the necessary technical updates. I thank you so much for your attention and have a very pleasant evening.
Thank you very much, the Chairman of the Presidential Task Force and my colleagues in the team. I equally welcome all of you here present, and particularly our friends from the media and various agencies hereby represented. I commence this briefing on a sad note, as Nigeria has crossed the figure of 1,000 in respect of deaths arising from COVID-19 pandemic. Precisely, we are at 1,002 as of yesterday. Some of us had one relationship or the other with these people that had exited the terrestrial plane as loved ones, friends, family members, colleagues, neighbors, co-workers, etc. While praying for peaceful repose of the departed souls, may God comfort the families of those left behind. We refuse to be discouraged by this situation. Rather, we remain resolute in our determination to defeat the COVID-19 scourge. We cannot overemphasize the importance of adhering to the non-pharmaceutical interventions to curb the virus. We have recorded 52,227 COVID-19 positive cases out of 379,542 samples tested so far, and treated and discharged 38,945 persons. As we continue to learn from experience gathered from managing COVID-19, the need to improve quality of care, health system strengthening, and seamless patient evacuation, especially in emergency situations, has become crucial. We shall therefore continue to review and strive for improvement in the treatment of COVID-19, particularly the symptomatic ones and the older adults and those with already existing medical conditions, with a view to reducing our case fatality rate, which currently stands at below 2%. In the same vein, we shall not lose sight of the fact that COVID-19 is not the only health challenge faced by our people. We shall therefore ensure that routine services are strengthened. This pandemic has further underscored the importance of immunization and vaccination to good health. The strengthening routine immunization shall continue to receive attention, especially as Nigeria will receive her polio-free certification this week. Last Friday, 21st August 2020, the Honorable Minister of Health commissioned 456 motorcycles and computers meant to enhance the ability of routine immunization officers to support supervision of service providers and the generation and on-site utilization of program data to continuously improve the quality of the immunization program in Nigeria. We have continued to interface with different professional groups using different fora, like meetings via online platforms locally and internationally. This is to keep in touch with new findings and treatment measures, as well as peer review engagements. We had a meeting with the Association of General and Private Medical Practitioners of Nigeria and the Guild of Medical Directors last week. One of the highlights from the meeting was the pledge of these private medical practitioners to support the National Emergency Medical Services and Ambulance System, NEMSAS, a baby of the Federal Ministry of Health undergoing incubation. Moving forward, we shall work together in partnership with our colleagues in the private sector towards improving the healthcare delivery of our country. I thank you for your kind attention.
Chairman, sir, good afternoon. Honorable ministers, gentlemen of the press, I think it's good evening, not afternoon, but in the evening. So my focus today is on the health workers. Since the beginning of the outbreak, we have prioritized the need for healthcare workers and the health facilities. And this is to ensure that all necessary personal protective equipment and medical consumables are readily available as they continue to manage COVID-19 cases across the country. In addition, with the guidance from WHO and evolving evidence on the disease, we have continued to develop guidelines, including the use of PPE and infection and prevention control measures. These are available in the health facilities and can be assessed, that's the guidelines, can be assessed via our COVID-19 ncdc.gov.ng. The role of the health workers in this pandemic is critical, and no health worker should be put at risk or die as a result of taking care of patients. Therefore, we continue to intensify efforts to train all frontline responders on the effective implementation of the infection prevention control measures for COVID to limit the exposure to disease and other disease outbreaks and break the chain of transmission. This is critical as activities gradually resume in our society. We're talking of bringing in, opening up the airspace. The land borders are also, people are coming in through the land borders. We're talking of opening up schools. We're talking of opening up other places of business. And so, health workers are those that will be the first responder when people have issues. So IPC begins with every health worker maintaining high index of suspicion for every patient that comes in for treatment. This is key at all levels of healthcare, whether it's primary, secondary, or tertiary. We are also emphasizing to state the need to have the triage station at every health facility, and this means that having trained health workers who are the first point of contact and ask questions to determine the priority need or proper placement for treatment of every patient. This is important for case management and appropriate channeling of human and material resources. Our ability as health professionals to maintain high index of suspicion for COVID or any other infectious disease will go a long way to enhance the response and to ensure that there is no further transmission of the virus to the health worker or other patients and people in the healthcare setting. Recently, we launched the online certified course on infection prevention and control in the context of COVID-19. This is actually targeted at healthcare workers. However, anyone can log into and get trained. At least there's no harm. You can train yourself on the IPC so that you understand the safety precautions that we need to take. The course actually features modules, standards, what we need to do in terms of the kind of precautions we need to take if there is a patient that comes in. And as lay people, we also need to know why the health worker needs to do some certain things, why they need to put on their gloves, why they need to wear their face mask when they are attending to us. So I urge all health workers, so take this course. It's very important, and it can be accessed at the microsite. It's called the elearning.ncdc.gov.ng. So, in conclusion, in the absence of a known treatment for COVID, compliance with IPC and other public health measures remains the most effective intervention to control the ongoing outbreak. At the NCDC, we will continue to build and strengthen the capacity of our health workers and effectively fight the disease. And like was said, we need to put on our masks, do all the non-pharmaceutical interventions that we have been told to do, our face mask properly worn, covering our nose, washing our hands regularly, and keeping the physical distancing. And for sure, we'll be able to overcome this COVID. Thank you.
The Chairman of the Presidential Task Force, honorable ministers, members of the PTF, gentlemen of the press, good evening. I'll be talking about the protocol for opening international airports. I'm not going to go into huge detail, but the DG NCAA will also support the process. As you're aware, we have asked the aviation authorities to prepare to open international travel from the 29th of August 2020. This will be dependent on ensuring that all COVID-19 protocols are in place. I will be talking about the new protocol that has been approved today by the Presidential Task Force. Please note that this protocol will become effective on the 29th of August. For the moment, all travelers coming into the country will continue to observe the old quarantine protocol that we currently have. We will be continuing with the process of requesting for a negative PCR result for all passengers boarding to travel to Nigeria. These COVID tests must be PCR tests. We will not accept serological results. As mentioned by the PTF chairman, we are concerned about the quality of some of the results and the discrepancy we are getting when passengers are subsequently tested in country. For this reason, the protocol that has just been approved will be reviewed after 4 weeks, and we will also be looking at the level of discrepancy between negative and positive results with a view to developing a list of accredited laboratories for countries that we frequently receive travelers from. In that regard, once we have a list of accredited laboratories working through the different embassies, we will insist that passengers use these laboratories for the tests. All intending travelers to Nigeria must have tested negative for COVID-19 PCR before allowed entry into the country. We are narrowing the period of validity for the PCR test from the current 14 days to 7 days from the 29th of August. Preferably, the PCR test should be done as close as possible to the point of departure for Nigeria, preferably within 48 to 72 hours, but we will still accept results that are valid within 7 days. Prior to boarding, we are currently developing a payment portal, as you are aware. At the moment, for all evacuation flights, the PCR tests that we do in country have been sponsored by the Aliko Dangote Foundation. We are very grateful for their generosity. We have had more than 13,000 Nigerians, stranded Nigerians, brought into the country as a result of this process. But from the 29th of August, travelers will be required to pay for their COVID-19 test in country. We are developing a national payment portal, which will link to the current Lagos payment portal that is already active for passengers. And we will allow validated, accredited private laboratories in the country to provide these services. We will provide you with additional information on the payment portals and information on the list of accredited private laboratory providers, as well as sample collection centers across the country on the payment platform, as well as the NCDC website. In addition to this, and in order to ease the discomfort and inconvenience to passengers of delays in being cleared from airports, we are currently working on switching the health declaration or self-reporting form that is currently being filled manually to an electronic format. And passengers will be asked to fill this form immediately before boarding so that the electronic version can be submitted and they can be cleared quickly when they arrive. We will continue with the policy of ensuring that airlines only board passengers without symptoms of COVID and with negative PCR results. Airlines will be fined $3,500 per passenger if they fail to comply with pre-boarding COVID requirements. On arrival in country, from the 29th of August, passports will no longer be retained by the Nigeria Immigration Service. Rather, passengers will be allowed to proceed and exit the airport once they can show evidence of a negative COVID PCR result, evidence of payment for a repeat PCR result in country, and where possible and where we have been able to sort this health questionnaire form that has been submitted either manually or electronically. Passengers will be asked to proceed on self-isolation at home for a period of 7 days. On day 7, they will proceed to their sample collection center or laboratory, private laboratory, for a repeat COVID PCR test. By day 8, if the PCR test is negative, they will be allowed to exit isolation. Based on scientific review, rigorous scientific review, the PTF has decided that it will be safe to shorten the current quarantine period or self-isolation for passengers coming into the country from 14 days to 8 days, provided they have a negative PCR result from day 7. Passengers will be monitored by public health officers throughout their period of self-isolation. Those who develop symptoms will be treated in the same way that we currently manage COVID-positive patients within the country. In terms of compliance, ensuring compliance with COVID-19 protocols, we are currently working with the Nigeria Immigration Service to design a system that would allow us to determine those that have not submitted themselves for repeat COVID PCR test at day 7 onwards. These passengers may be sanctioned with inclusion on a travel watch list or their electronic passports suspended for a period of time if they decline to have a repeat COVID PCR test or disappear from the isolation process. We will continue to pay very close attention to the issue of laboratory accreditation throughout the country as well as outside the country. And this protocol will be reviewed 4 weeks after to make sure that the results that we are getting for passengers pre-boarding continue to be reliable. And if there's a need to review this policy, it will be done. Thank you.
End of the segment on technical updates. We will switch over now to the question session. Are you ready with your questions? Okay.
Good evening, sirs, members of the Presidential Task Force on COVID-19. My name is Yemi Adebayo from AIT. I have some couple of questions for the PTF this evening. The first, the representative of the NCDC DG, I quite appreciate the fact that you talked about providing PPEs for health workers and what have you. But I want to direct these questions to you, or perhaps the SGF can also answer this question. Providing PPEs for these health workers is a good thing, but their welfare as well perhaps is more critical. I asked this question based on a call I received over the weekend from a female doctor at one of the isolation centers. And she told me that for the past 3 months now, they've not been paid their allowance and their salaries. They had planned to embark on a protest, but perhaps the authorities concerned actually came in to arrest the situation. Are you not concerned that providing them PPEs to work without attending to their welfare will lead to a major setback in the nation's fight against COVID-19? Then secondly, I want to ask, we're already in the 3 weeks of the 4 weeks extension that we have of this current phase. If we are to do analysis, would the PTF confidently say that the level of compliance is high now, or are we still where we are? Then the final question I think I want to ask is on the issue of the protocols that the national coordinator just spoke about now. The PCR test that you're requesting for, would it be that each passenger who are coming into the country has to do this test 48 hours to or 72 hours to, depending on the time frame? I want you to clarify that, sir. Thank you very much.
Good evening, honorable ministers, my colleagues. My name is Friday Okerigbe. I'm a reporter with Channels TV. Let me start with the national coordinator, the protocols that you just read out. I would like to seek clarification. We have cases where people, especially those who are asymptomatic, remain so even after 10, 14 days. What will be the fate of such ones who intend to travel into the country? Supposing they remain asymptomatic where they are and they have spent more than 10 days, would you allow them to fly in? Then my second question is directed actually to the Minister of Education. We have been test running that sector, the reopening of schools with the exit class students. And with my calculator, I think this is the 3rd week already. From what feelers are you getting? Do you think it is safe to reopen the whole sector for students to come back to learning? I'm asking this because I'm sure you noticed that last week there were so many agitations. Some students from the higher institutions, they protested in this time. And parents are also getting agitated. Those who have children in universities, polytechnics, and other higher institutions. So from what you have seen in these 2 weeks, or 2 weeks plus, do you think it's safe to reopen? And closely related to that also is also a concern from some parents who are suggesting already that the federal government will think about giving automatic promotion to students so that Nigeria cannot run an academic session of January to December. You know, we're running first term, September to December. That is the kind of calendar we're running now. They are suggesting that if you give automatic promotion to students, they can resume in January, and let us start first term from January. So our academic session will now run from January to December. Is that part of the things you'll be discussing with the stakeholders? Thank you.
Good evening all. Rachel Abuja from the News Agency of Nigeria. My first question is for the Minister of Health. So far, WHO has trained more than 50,000 health workers in Africa on IPC. and hope to raise that amount to 200,000. Now, I would like to know what strategy your ministry has in place on ground to institutionalize IPC in our health institution, as current data reveal that less than 16% of hospitals in Africa, including Nigeria, scored above 75% on IPC protocol from a baseline survey. My next question is for the NCDC representative. What's NCDC doing to increase cooperation with states on sample collection sites? My last question is for the coordinator. So Nigerians would like to know which novel funding or innovation around this pandemic as the federal government done that has shaped our response to this pandemic in the past 5 months. And this brings me to my next question for the chairman. So we are aware that Nigerians have shown their creativity during this pandemic with innovations. The latest or last one being a decontamination chamber by one engineer, Williams Gian, which many experts in Nigeria actually commended. I would like to know if the FG is having any plan to support these innovators for mass production of this critical IPC equipment. Thank you very much.
The Chairman, National Coordinator, members of the PTF, my colleagues. My name is Amaka Ude. I report for Arise News. And my first question actually goes to the National Coordinator. It has to do with the protocols that you've just reeled out to us. How many days before departure should a person go have their test done before they plan to travel? I ask this because we are still having the challenge of getting results on time in the country. And that also ties to the representative of the Nigerian Center for Disease Control, DG. My colleague and I, she actually had a test done not too long ago. The result is still not out, 10 days after. I remember you said you had developed that website where people can have a code and go check. That is not functioning. Please, we need an update on that because getting the results on time is really important to us. And also to the National Coordinator, staying with you, you did mention that those who eventually, when they come back into the country, if they test negative after some time, then they can go in. But those who test positive, will they be isolated with those who tested positive in the country in our isolation centers? And will their treatment be free, or will they be required to pay? And finally, to the chairman. Well, last week you had told us that evacuation of Nigerians was going to stop on the 22nd of August, so that to allow the airports prepare for reopening for the international airspace. But you're still speaking about evacuating more Nigerians. Did that change somewhere? Thank you.
Good evening, Chairman and members of the PTF. My name is Mitaire. I report for the NTA. I remember some times back I raised the issue as to how you intend to ascertain the reliability of the test results that come from abroad. And then the response was that most of the labs abroad are trusted. But today we are discussing the issues. And you might be able to determine the labs that you trust in the country, the accredited lab. But what about those abroad? And that's why I'm still asking, are you going to designate some lab abroad where the test results will come from for international travelers that are flying into the country? I think that needs to be determined and ascertained. For the Minister of State for Education, during the lockdown, a lot of private schools took advantage of various online platforms to continue learning. And up till recently, many have conducted their promotion examinations. But this is not so for public schools, and many Nigerians are asking, how will students in public schools be assessed for promotion when schools eventually resume? Will they get mass promotion, or there will be sandwiched examinations to grade them? What specifically is the plan in this regard? And in addition to that, there are insinuations that school fees will be written off for students of public schools when they eventually resume. Can you clarify this, sir? Thank you.
Good evening, sir. My name is Hassan Umar Farouk. I report for Liberty Radio and Television. I am a COVID-19 survivor. I contracted this disease, and I was tested here. I spent 11 days in Idu Isolation Center, and I was under the good care of Nigerian nurses and doctors, and they treated me very well, and I resumed lately. Idan ila baka yadda cewa wani ya taɓa kamuwa da wannan cuta ta coronavirus ba, to ni na taɓa kamuwa da ita. Kila in kana jin jawabi daga jami'an gwamnati baka yadda ba, to ni ɗan jarida ne kuma ba zan yi ƙarya ba. Na kamu da wannan cuta a lokacin da nake aiki, an gwada ni, na kuma kwashe kwana 11 ana kula da ni a nan Idu Isolation Center. Mr. Chairman, sir, there's this question to you, sir. At the beginning of this, of the briefing of Presidential Task Force, you made a simple revelation, but it's shocking to Nigerians, by admitting deficiency in our health sector. It is alien for a Nigerian, a government official in your position to admit failure in the system. But an expert view it as a good thing to the country because it shows sincerity that things are going to be okay at the end. It's ordinary Nigerian that will benefit from this admittance. So far, we want to know how many wrongs were corrected, and so far, how was government able to what the government did so far, so from then to now. Zan so kai da Hausa cewa lokacin da ka tsaya nan kuma mutane sun girgiza sosai 'yan Najeriya lokacin da wani babban jami'in gwamnati ya tsaya a kafar talabijin kai tsaye ya faɗi cewa akwai matsala a Najeriya musamman sashen nan na lafiya. Ya ce kuma wannan cuta ta coronavirus ita ta wanda asirin da ake da shi ba a Najeriya ma har ma a kasashen duniya waɗanda suka ci gaba. Muna so mu ji daga bakinka, shin ya zuwa lokacin da kai waɗannan bayanai, waɗannan matakai kuka ɗauka don ganin cewa an gyara al'amura kuma ɗan Najeriya ya ci moriyar gyare-gyaren da kuka yi wanda kai da kanka ka amincewa cewa akwai matsala. Thank you very much.
Thank you very much. We have taken all the questions. Our responses will be coming from the Honorable Minister of State for Health, the DG NCDC, the National Coordinator, Honorable Minister of State Education, in that order, before it is rounded up by the Chairman of the PTF. We'll invite the Honorable Minister of State for Health to the podium.
All right, thank you very much. Once again, Mr. Chairman and my colleagues and the House, thank you very much. I have just one query to respond to, and that's from Rachel, News Agency of Nigeria. Hope I got that right. Thank you very much for your question, which has to do with our infection prevention and control protocol. And you did say that the WHO has already helped in this regard by training 50,000 health workers, and that the target is to go up to 200,000. Let me start by thanking the WHO and other agencies that have helped us in this our quest to defeat COVID-19. Of course, the WHO, the EU, Africa Center for Disease Control, West African Health Organization, and so many NGOs, so many even individuals that have helped in one way or the other, either through material support or through training of personnel, particularly in the area of human resource for health. Now, to start with, you will agree with me that even the number of 200,000, which is the target, even if it's met for the whole of Africa, that is still small. But we want to acknowledge and thank them for even assisting. So what that ordinarily tells me is that we need, as individual countries in Africa, to own the program itself. That is, the training program for our health workers in infection prevention and control. That every state, every nation, state within the Africa region should be able to, and that's what we are also doing. The NCDC is doing so so well, even in that regard. And the NCDC has, time and time again, trained a number of health workers, in this regard. And like I did say, I know that the Africa Center for Disease Control was also on hand some time ago to do same in terms of training of our health workers in the area of infection prevention and control. So that's the first thing. I think the next thing to say is that, because you were asking of the strategies that we are looking at. So for me, the first thing is to own the program itself. The second thing for me is the need for us to even have PPE factories, as it were, so that we don't have to import. The more of these things that we, have produced at home, the better for us. It's also important to talk about the issue, because part of the training, again, is a judicious use of PPE so that you can also combat infection. Because oftentimes it's not just having PPEs, but if the use of the PPE is not properly done, you can still have health workers being infected. And again, these are things ordinarily that we should be doing on a routine basis. That's another part of the strategy. That is, get to do these things routinely, so that it's not when we have a situation like this that we now go on crash program and call it fire brigade approach. These are things that should go on as a matter of routine. Just like we are talking about our immunization, we don't need to wait until there is an outbreak. That's why we talk of routine immunization programs as opposed to fire brigade immunization program. It's the same thing for IPC training. It should be a routine part of the strengthening of the health system that we need to engage in. So for me, these are just some of the things that we should continue to put in place, and I'm sure that NCDC is very much aware of this and doing its best in that regard. Thank you very much.
Yeah. Thank you. Yes, I talked about the providing PPEs. Of course, providing PPE is also part of the welfare. And so we are also taking care of the welfare of the health workers by making sure that they are well protected. In the other areas of salaries, I think my Honorable Minister will be able to say more on that. And then this also is, will also be at the state level, because do not forget that we have various levels of engagement of the health workers. And so you engage at the state level, the welfare is also at the state level, then the federal also. So I will not be able to go into that in terms of the welfare, but I know the PPE is also part of provision of welfare, making sure that they are well protected. And We talked about the support and how do we cooperate with the state. Yes, there are a lot of things that we're doing with the state. We have been supporting them in provision of materials and technical support. Now we have the funding from the World Bank where they're using their incident management plan, the activities in their incident management plan. And part of that activity is for them to expand the sample collection sites. So that's one of the areas we're supporting them technically to make sure that all LGAs in their state have a sample collection site, at least one sample collection site per LGA. What are other ways? We have our team members in the state working with the state team to assess the sample collection sites that they need to take, the areas that they need to use. The other areas is providing guidelines, because that is very key, because you need to know what to do. So we have provided guidelines for them to be able to set up sample collection sites in their various local government. And then there is about the results. Yes, I mentioned here that we have automated the results for negative tests, and we opened up the platform the 9th of, I think, Wednesday, because I mentioned it on Thursday, the 9th of Wednesday. And for results that are backlog, you will not get a text, because that is backlog. So I'm not sure when the person went for the test, but any results from the date that we opened up, you'll get SMS giving you your negative test results. Please note, it's negative test results, not positive. But, you know, technology, sometimes you launch something and sometimes you have issues in terms of the internet. So I'm not saying it's perfect. We're still working on it. But if you have issues, please let us know if there are any issues that we need to attend to. We're all trying to make sure that things work. So we'll appreciate if you have any other issue, just text us, send us a note, and then we'll look into it and try and correct it. Thank you.
So I'll clarify some of the issues I raised, and I'll then ask the DG NCAA to contribute as well, since this is really an aviation issue. First of all, with regards to the validity of the PCR test, here I'm talking about passengers that are outside the country and coming into Nigeria. They are the ones that we are most concerned about, okay? So for those passengers coming into the country, based on the current protocol we have, the PCR test that you present at your departure airport before coming to Nigeria, before boarding, has a validity of 14 days. We are shortening that validity to 7 days. And what I said is preferably do the test as close as possible to the time you board. Why? Because if you do the test as close as possible to the time you board and it is negative, on arrival, it's very likely to be negative, because we will not be doing tests on arrival. So that's why we are shortening the validity period for the PCR test. With the current protocol, we do the test on arrival within a day or two, 24, 48 hours, you go and have the test. So, which was fine to have a long validity period, because we will still repeat it within a day or two. This time around, we are not testing on arrival at the airport. We will be testing you 7 days later, if that makes sense. Therefore, the validity has been shortened. If you happen to leave the country, if you happen to leave Nigeria and you go abroad for a holiday and you spend 10 days abroad, when you are coming back, you have to have a PCR test that's valid within 7 days. But let's say you do a PCR test in country here, and you leave and you go for an official visit and you spend 2-3 days abroad. On your return, you don't need to repeat the PCR test because it's still valid within 7 days. But we will prefer you to do it as close as possible to the point of boarding. What happens if you are asymptomatic and you've been out of the country for 10 days. Well, tough. You still need to have a valid PCR within 7 days, okay? How many days before departure does a person need to do a test before travel? So here we're talking about a different situation. We're talking about somebody in Nigeria leaving the country. Different countries have different processes. Some countries want you to come with a negative PCR result. Some countries want you to have a test on arrival. Some countries only ask for you to be isolated for a period of time when you arrive. And some countries only take your temperature and symptoms and allow you to go. So it depends on the country you are going to. However, having said that, most airlines nowadays demand for a PCR test for COVID. And the closer to the time of departure you do the PCR test, the better. It depends on the airline. Some ask for a validity of 72 hours, some for as short as 48 hours. But because we are in country, we are trying to separate the functions of the public health laboratories with the functions of commercial entities. When it comes to travel, we do not want the public health laboratories to be distracted by testing for passengers. And that's why we are encouraging the private labs to get accredited so that they can provide this service. And this service can be done as efficiently as possible. There are certain criteria that these private labs have to meet. One, they have to be registered with the Medical Laboratory Scientists Council of Nigeria. Two, they must have undergone a process of validation by NCDC. Three, they must provide the reports, the results of the tests that they do must feed into the national system. And then finally, they must be recognized by the state authorities where they are co-located. So for example, Lagos has about 12 private laboratories that they've recognized, that have been accredited, and at the moment are testing, and the results feed into the Lagos numbers. The same with Abuja. There are some laboratories in Abuja that are either already reporting or are in the process of being set up. Those lists of accredited laboratories will be provided on the payment platform and will also be provided by NCDC. So when you are leaving the country to go abroad on your holiday, we don't want you to go to the NCDC to have a test done. We want you to go to an accredited private laboratory, pay for the test, have your results, and they are very quick. Some of them can turn around the results within 24 hours. Have a printout of your results and then get on your flight and leave. Or get on your flight and go on holiday. So that's the process we are looking at. One of the advantages of pushing the private sector to do more is when you look at our numbers, on average at the moment we are testing about 3,500 samples every day. The travelers in Nigeria, both to and fro, if you combine, NCAA DG might correct me, but we are talking about at least 10,000 passengers a day. So that's an additional 10,000 tests potentially every day. It's going to contribute hugely to the number of tests that we do in country. And the more reason why we need to get it right. We talked about the issue of accreditation from outside the country. So the main challenge we are having is there are certain accreditations like ISO certifications, etc. If we impose these rules on labs outside the country, we don't have a lot of ISO certified labs in country. So we'll be shooting ourselves in the foot. But there are countries that we are currently scrutinizing to see why we have such a discrepancy between the results that passengers present and the results of the tests that we do in country. This might be a quality assurance issue, or there might be some other reasons behind it. Whatever is the case, we will scrutinize these results, and for those countries, it's very likely we will come up with a list of accredited labs working with the embassies and insist that passengers only use those labs for their tests. It's not possible to apply this internationally, otherwise you could have a list of 1,000 labs, and no sane port health official will be able to scrutinize tests that where they have a list of 1,000 labs that they have to go through, unless you have electronic systems. But as I said earlier, COVID is a moving field. It's quite possible in the next few months we might get a very reliable, rapid diagnostic test, in which case we will stop relying too much on the PCR test for passengers coming in and be doing rapid diagnostic tests as passengers come in and release them into isolation, because that's the fastest way of doing this. We do not have the time right now to put up infrastructure at the airports, but I will leave the DG to talk about the process and how difficult it is. And because we need to open up by the 29th, this is why we have to go with the current arrangement. But as I said, we will continue to review and make sure that the current arrangement works. But we need the cooperation of all Nigerians and all travelers. And when it comes to making sure that we enforce the day 7 testing, as I said earlier, we are working with the Nigeria immigration authorities and the Ministry of Interior. And there are ways around this. We will not collect people's passports, but there are ways of ensuring that people test day 7, including reminders from the private laboratories that they have paid into, and also reporting of non-compliant persons back to the port health authorities. The question by Rachel, I think that's a very difficult question. What innovation has driven the national response for the last 5 months? Well, I'm afraid it's will be here till tomorrow if I have to answer that question. But all I can say is Nigerians are very innovative. And even by looking at the number of laboratories we've had, from 0 testing COVID now to 64, by looking at some of the inventions we've had, like ventilators, etc., there's no doubt that the country is not short of innovative minds. I would like to invite the DG NCAA to, if there's anything else he may want to add. Thank you. Oh, I'm so sorry. That's right, the management side. So it depends on the states they are in. They will be treated exactly the same way as somebody who is tested positive in the community now. So if it's in Lagos, for instance, a lot of the positive cases in Lagos self-isolate at home unless they develop symptoms. If it's other parts of the country, they go into supervised self-isolation. They will not be charged for treatment. Thank you.
Good evening, the chair of the PTF, honorable ministers, members of PTF, ladies and gentlemen of the press. As the initial coordinator said, we have just 5 days or more to open the airports. And right now, the aviation sector is working assiduously to be ready for the 29th. And this working entails liaising closely with the initial coordinator on the port health services to develop protocols for testing coming to Nigeria. The aviation sector is quite comfortable and agrees with the protocols of the pre-departure PCR test. We are quite comfortable with that. As he mentioned, you can imagine trying to test 10,000 people at the airport, the chaos on a daily basis between the airports, 10,000 people average on a daily basis. So we can imagine the chaos and the issues it's going to bring. In addition to that, we do not have infrastructure at the airports to deal with this. The airports were never built for such, so we need to build infrastructure. But even at that, even if we have it, it's going to create crowding at the airport. It's going to bring facilitation problem. People are going to waste time at the airport, and it's ultimately bring unruly passenger behavior. People would get angry, and that could lead to further security issues. So we at Aviation, we are quite comfortable with the arrangement of the pre-departure COVID testing. Thank you.
Well, thank you, and good evening, everybody. The issues surrounding the education system or the education ecosystem are quite large. There are a lot of them. But the key things that you've pointed out, which is the agitation by several groups around Nigeria, especially our students, urging the federal government to reopen the tertiary institutions and asking whether we've learned anything in the last 3 weeks with which we can thus be informed. I would like to report that, truly speaking, remarkably, Nigerians have done very well conducting themselves in the last 3 weeks. We commend them. But the science is still out. Rates of infections are not dropping. Positivity rates are not dropping. The supposed regimes around how this infection can be curtailed are not yet ascertained as now properly in place. Yes, Nigeria has made tremendous improvement from where we were 6 months ago. 6 months ago, we had less than 2 labs. Today, we have in excess of 62 labs. 6 months ago, Nigerians had limited bed spaces to react to the pandemic. Today, courtesy of the federal government and the work that's been done with all our state and other partners and all the donors, Nigeria is a little bit better equipped. As you have heard from the Minister of Health, Minister of State for Health, he has pointed out that even things like PPE have now become common regiments around our health infrastructure. So really, there's been a lot of improvements. However, what we have done and pursuing reopening, we have presented to all the tertiary institutions in Nigeria. And you just don't only look at the 200 or so universities and colleges of technology. There are really a lot of other colleges, College of Nursing, colleges of agriculture, colleges of several colleges. There are nearly about 600 post-secondary institutions available, all waiting to take on this signal whether to reopen. And the guidance we have given, and for which we are receiving feedbacks from many of these institutions at the moment, includes a gamut of items that you need to prepare. And we don't want them presented as potent chemins. You know, we don't want them just be facades. We actually want content around them. And we're going to go back to really figure out whether people have complied with those requirements. So this morning, or this afternoon, myself, the Minister of Education, Malam Adama Adamu, the Executive Secretary of the Nigerian Union of Universities Commission, and the Permanent Secretary all met, and we've been at it since morning. We've reviewed responses from about 78 universities already. Most of them are private universities who are already insistent that they are ready to go. And many public universities, from the state-owned universities, we have 50-50 response. And so we're working to upscale that and make sure that everybody actually is ready to go. When all of this is taken in context, we will have them back inside the PTF so that all these eggheads you see here from NCDC, all the various players in the PTF family, will then review it. So we can give a go-ahead that things can then go on. We are positive that time is almost around the corner. But we don't want to bandy around dates, but we remain positive. And the sooner we can get that, the better. So I urge our students who have actually exercised a lot of patience along with their parents, because I know even my own children, they are beginning to think they've had enough of me. I understand that. And so it's like that in many homes. So really, I urge you to just bear with us a little bit more. The riotings need to stop. There's nothing to riot about. We're in full negotiations with ASU. They are fully engaged with this. And every player is engaged. And like I said, this is the PTF profiles for Nigeria a national response. And then every other person can tee off from there. We will then announce when others can resume, because this idea also dovetails into the issue of when other strata of our education network can resume, whether they be primary, our pupils, what they're going to be doing, or students that we have at post-basic. When they do, yes, some private institutions have done a little better than others. Some have actually done better than public schools. Well, there are also public schools that have done well. The curriculum is available for everybody. And we will measure those who have met it at where they are and some of the gaps, so that the states can advise those who run the primary sector and advise on what really needs to be done in order to harmonize. There will never be a one-size-fits-all around Nigeria, and I don't suppose we are trying to do that. What we're going to try to do is provide this guidance over how all of us work together. Already some things are already ahead of us. We had already concluded JAMB. So we may not necessarily be in a position to say everybody who scored JAMB this year will not go because we are waiting for some automatic provision. No. There's a holistic content around this, because many of all our schools had already completed their second term classes already. So third term is actually just what is in view. And the normal number of weeks and class time, 40 minutes class belts for teachers and their pupils, versus classes that are required for conclusion of particular subject classes, be they biology, methodologies, and so on and so forth. All of that will be put into context and see which of them the syllables of the next classes can carry, while the teachers migrate those who can. But this idea about there will be, because you're in a public school, there will not be any exam, there will not be any more learning. You just go to there. Yes, it might sound nice, but it does not help the child. We just want to make sure everybody who is saying that they're in class primary 3 are actually in primary 3. We'll be able to do that. And we are sure that the infrastructure and the teaching network we have will be able to do that. If we then discuss fees, for us at public schools, really the federal government, provides education really technically free, tuition free, but there are other costs that are associated with running a school, depending on where you are at. Those are really local. The federal government really doesn't take anything back. They offer everything that they have, and then everybody else uses that system. So, depending on the particular school you are at, there may be variations in costs as to what this will be. And I'm sure the schools will be able to determine those there and dematerialize them from exactly what it is being used. Those who offer online services. Right now for the universities, TED Fund is on the verge of launching a VLE for all the universities, so they can actually log into it without payment, so that it's available to all public institutions free of charge. However, there may be other faculties and people who have different requirements. Those fees may apply. At the primary school level, vis-a-vis our colleges, There are also variants in fees that are required at those levels. Some of them relate to the particular functionalities which that school provides that otherwise would not be available if they didn't have the resource. So I would like parents to examine the bills that they get and decide which ones that they're able to accommodate. Those are our interim advice at the moment, and we will show up all our responses as soon as further information is made available from the contents we are delivering. Thank you very much.
Thank you. I will now invite the chairman of the PTF to the podium to round up the day's proceedings.
Thank you so much. The question on salaries and hazards allowances, I think it has been answered by the NCDC. But basically, I don't think at the federal level, I can say for certain, nobody is being owed any salary. Allowances, yes. There was a plan to pay for the first 3 months and monies were voted for it. I think that has been done substantially. We are working towards making sure that funds are made available for subsequent payments over the months. But as for salaries, I can say with every degree of certainty that at the federal level, all the medical personnel that are employed by the federal government of Nigeria have received their salaries to date. That I'm sure of. I stand to be corrected. Issues of salaries. Provided you are on the IPPIS, you get your pay as and when due, except there are issues with your documentation on the IPPIS. I believe, but if there are specific areas or specific persons that have not received, they can come back to you so that we can take it up and find out why they have not been paid their salaries. Sometimes it takes quite some time. By the time you are employed, you are captured on the payroll, you are captured on the IPPIS. When I was appointed managing director of NIWA, and I went to Lokoja, I think for the first 3 months I didn't get salary. 3 months. And I was battling on getting onto the IPPIS. I came to Abuja several times to ensure I would do the documentation. I would go back waiting for the salary. The next month it would not appear. For the first 3 months I didn't. So it's not, for people who have been engaged by the public service of Nigeria, they know that this process sometimes is rather long, cumbersome, but eventually you get paid everything. So if there are those kind of situations, I would appeal to the people concerned to just be patient a little bit, follow it up, and eventually it will be cleared, provided it's been captured in the personnel cost of that organization at the beginning of the budget year. Sometimes the problem is that it is not captured. And there's nowhere the authorizing authority will get money to pay you if it is not captured in the personnel cost. They can't go into their capital expenditure and pay salaries with it. It has to come from that specific goal. That's why whenever agencies employ people, they sometimes wait to see what the budget office will give them as their personnel costs, to see if that can be accommodated in terms of salaries and wages and other costs that comes with it. Yes, Rachel, Engineer William Gang and his the ingenuity in creating the contamination chambers. Well, I leave the sciences of the effect of the decontaminating chambers to the experts to deal with. But I can assure you that I'm extremely proud of our response, particularly when you look at how the government has responded to our economy. The first thing that the president did was to establish an economic committee headed by the Minister of Finance, Budget and National Planning, to look at the impact, the negative impact of COVID-19 on the economy. It was followed with the establishment of the Economic Sustainability Committee, chaired by His Excellency the Vice President, which came up with an economic sustainability plan that is supposed to run for 12 months. And the total amounts of money that has been targeted for that plan is 2.6 trillion naira. It's a lot of money, and all geared towards different sectors of our economy. And the Ministry of Industries, Trade and Investment has a substantial chunk of this money to help grow businesses, to help inventors. In addition to that, the central bank has provided funds through different lending processes. The first 100 billion for hospital and major pharmaceutical companies. The next was the 50 billion for businesses that are adversely impacted, particularly the hospitality industry and other forms of businesses. So there has been a major consideration in trying to support, grow the businesses of our inventors, and also help sustain businesses. Over the week, a friend of mine asked me to check up on some applications he did. I even found out that in the central bank NISAL COVID-19 package, there's even a provision of 2.5 as palliatives to owners of businesses who have been impacted negatively by the COVID-19. And once it's a palliative, it's not a loan. What it means is that government is given that to cushion the effect of the impact that your business has taken, so that if you have, say, 10 employees, you will not lay them off because you have received this support and this cushion. So, like I said, I'm extremely proud of what we have been able to do as a government in helping to sustain our economy and even helping the new inventors and those scientists that are hurrying to procure one form of local cure or the other for our people. So much resources have been made available. The process of validation must be taken into consideration, and our people should be encouraged to take the opportunity and the liberty of accessing these funds. I always encourage people, go on the website of the CBN, go on the website of all the lending major institutions. You'll be able to find a place where you can get the necessary support that your business deserves. Amaka, but the date I gave was 25th. The national coordinator, and I remember the Minister of Aviation, had given 22nd. But we have information that there is a special evacuation that ought to take place tomorrow. So the last time I spoke, I gave 25th as the last day for evacuation. Evacuation flights are different from the opening that will come anytime from the 29th. The flights that will come in from the 29th are regular flights. And that is why you see even the modification of the protocol has been brought to bear. With evacuation flights, when you come, the testing that had taken place in the past, you don't pay for it. But as from the 29th of August, they are coming on a regular scheduled flight by the international airlines and one domestic airline that I think the Ministry of Aviation has also included in the list, starting with the two airports, Abuja and Lagos. You even have to pay for the test ahead of your travel by going on the online and filling up the forms and designating the laboratory where you intend to take the test. So there has been a little bit of modification to take care of the fact that those flights are not evacuation flights. We intend, for all intents and purposes, except for emergency, stop evacuation flights as from tomorrow, the 25th. I think tomorrow is 25th. After the last flight tomorrow, subsequent flights that will come in after the skies have been opened on the 29th, there will be scheduled flights. But in between, definitely there will be flights. Even when we had a total lockdown, emergency and humanitarian flights were allowed. So it's not a total closure. There will be flights based on certain needs and certain peculiar circumstances. So that is as far as that is concerned. Liberty, what explanation did you want me to do? What we have been able to achieve? Kache me? Mene kake son bada? Oh, okay, na gane yanzu. Well, kana son yi da Hausa kenan? Okay. Well, truly, I mean, I have said it consistently, that COVID-19 has exposed the weaknesses in our systems. It's not only in the health system. The truth about it is that even in our governance system, the fact that we have no social net and the level of inclusion in our governance system, the level of how we even run our federation in terms of the sharing of responsibilities has been exposed, and not only exposed in Nigeria, but all over the world. And I have consistently given this example when I see the American situation with 300 years of democratic practice under the executive presidency system, which we copied with some minor adjustment here and there. How the weaknesses of even their governance system has been brought up front. That it is at this moment that they are asking themselves who has the authority of imposing the use of mandatory use of mask in a city. That became obvious by the contestation between mayors and the president as to who has the right of putting in place certain regulations for certain actions. Who has the right even to determine when a city or a state opens after the lockdown as a result of the pandemic. So these exposures are there. The pandemic is the most extraordinary major health challenge that has confronted our generation. And as a result of that, it has opened up a lot of things that I believe strongly, if there is any lesson that we are going to learn from this process of our national response, is how we can fix some of the weaknesses that have been exposed. And I believe that we have tried as much as possible to be able to do that. Ramping up our testing centers or testing facilities from 2 when we started to 4, 5, and now we can count by the statistics given by NCDC that we have at least 64 locations where COVID-19 is being tested across 32 or 31 states of the Federation, who cover the entire nation. But I believe too, correspondently, as we have said consistently here, one of the major aspects of our response is to ensure that by the time this task force tenure is over, we would have set in motion the processes of ensuring that each state would have a structure befitting with the provision of molecular testing in each part of this, in each of the 36 states of the Federation with the Federal Capital Territory, and to provide also for infectious disease kind of facility. If peradventure in the future we'll have another pandemic, which would obviously come as long as man exists on the planet Earth, we would not have to start thinking about building the infrastructure. Because continuously I've had this question, why is South Africa testing more than Nigeria? Why is this other country testing more than Nigeria? It's as a result of the infrastructure they have put in place over the years. And these are infrastructure that you do not put in place in one day. They are structural, there are provisions of facility, so there must be a robust plan going forward. And I believe that truly, our health infrastructure must be rebuilt. There must be a re-engineering of our health infrastructure in such a way that in the future we will not be caught with our knees down like COVID-19 has done to the entire world. To gaskiyan abin da nake faɗi shine akan cewa da muka fara wannan aikin kwarai da gaskiya duk faɗin duniya ba a samu fahimtar wannan cutar corona ɗin nan ba. Kowace ƙasa tana kokari ta samo kansa. Mu ma a Najeriya mun yi kokarinmu. Na tabbatar kuma kokarin da muka yi shi ne ya nuna waɗansu nasarorin da muka ci har ga yau inda muka kai. Gaskiyar magana shi ne akan cewa lokacin da muka fara laboratory inda ake gwada wannan cutan guda biyu kawai muka soma da shi. Muka kai shi 4, a yau muna da wurare 64 a jihohin kasan nan inda ake gwada wannan cutan. Na tabbatar bayan wannan koronan ya tafi mun samu lafiya da zaman lafiya a kasan nan. Maganan lafiyan mutanen kasan nan ba za a sake wasa da shi ba. Coronavirus din nan ya nuna kasawar gwamnati duniya gabaki daya, kowace kasa a duniya, na yanda ake kula da talakawa, na yanda ake kula da lafiya jama'a, na yanda ake kula da yanda za a azurta mutane, yanda za a taimaka wa mutane don sun shiga wahala. Amma darasosin da muka koya a lura da wannan aikin nan da aka bamu, wanda President Muhammadu Buhari ya bamu fahimta akan cewa in Allah ya yarda Najeriya za ta canja. Abubuwan da ya kamata mu sa, abubuwan da ya kamata mu ɗauki matakai a kai, da jihohi da federal da kananan hukumomi za mu yi la'akari da su zuwa gaba, mu tabbatar mun tallafa talakawan kasan nan. Na gode.
Thank you, Chairman PTF. That brings us to the end of today's national briefing. But a quick reminder to all of us. One is that WHO has issued an advisory on the use of face masks by children. Particularly, the advisory says that children with a compromised situation should please use the mask irrespective of their age. 2 is that testing is critical to detection, tracing, treatment, and recovery. Our sample collection is still very low. We must reach out to all our relations, all our friends, to come out and be tested, particularly when they feel the symptoms. There should be no stigmatization. Nobody should be afraid of anything if you get tested. Managing COVID-19 is a joint responsibility. There has been a call here this evening to states, local governments, communities, and individuals that they should ramp up their efforts in creating awareness and in sample collection. You have also been advised to log on to elearning.ncdc.gov.ng